Good evening, and thank you so much for joining us for this week's Community Leader Telephone Town Hall. We're going to get started here in just a second. We're going to let our fellow neighbors join the call. I know a lot of you are joining right now as we speak. But as we wait for everyone to hop on, I want to remind everybody that if you have any questions that you would like to ask to today's speakers, which will include Dr. LaQuandra Nesbitt, the Director of the D.C. Department of Health, as well as Dr. Christopher Rodriguez, our Director of the Department of Homeland Security and Emergency Management. If you have any questions for them, you can press 0 now to get entered into our question queue. And want to remind everyone, the most up-to-date information and resources related to coronavirus, you can visit coronavirus.dc.gov. So we're just going to give it about one more second for our fellow neighbors to hop on, and we'll get started here in just a second. All right, it looks like everyone's been able to hop in. So again, thank you all for joining us for this week's Community Leader Telephone Town Hall. My name is Tomas Talamonte, Deputy Chief of Staff to Mayor Muriel Bowser, and I want to thank you for joining us this week and every week for our weekly check-in. We'll hear shortly from Dr. Nesbitt and from Director Rodriguez as well, but want to remind everyone, if you're just joining us, again, if you have any questions, you can press 0 now to be entered into our question queue. And then if you have any for the most up-to-date information and resources related to our coronavirus response and recovery efforts, you can visit coronavirus.dc.gov. So we will start now with remarks from Dr. Nesbitt. So Dr. Nesbitt, go ahead.
Thank you, Tomas, for the introduction, and welcome to all our participants in this week's Community Leaders Town Hall. I want to start just with giving a situational update with where we are in the District of Columbia. To date, we have 10,642 district residents who have been diagnosed with COVID-19, and unfortunately, we have 564 district residents who have lost their lives due to COVID-19. We are able to report that our hospital capacity remains below our goal of 80%, and our test positivity rate is currently at 3.2%. Today, during our situational briefing that we have as many times as 3 times a week, we wanted to make sure that we brought some attention to the need for residents in the District of Columbia to continue to receive preventive health services as well as emergency and urgent healthcare services that they need. This was very important to us because we recognize that prolonged medical isolation, when you are experiencing concerning symptoms such as chest pain, shortness of breath, or any complications from a chronic health condition, may have detrimental effects on your health. It is extremely important for residents to continue to obtain emergency care in person when medical attention is needed, especially those with pre-existing or chronic conditions. We also recognize that, in particular, older adults may be especially at risk, given that they may be more likely to have cardiovascular disease, diabetes, and other chronic medical conditions that make putting off emergency care especially risky. While we make this focus on older adults, it does not mean that young people or people younger than the age of 65 are more likely or exempt, rather, from these emergency and life-threatening events. Now, we do understand that the fear of exposure to contracting COVID-19 is very real, and it exists for people. It is important for all residents to know that it is safe for you to obtain the care you need, whether that care be preventive health services for your children, receiving prenatal care during your pregnancy, or ensuring that your chronic health conditions like diabetes, seizure disorders, and high blood pressure remain under control. The team at DC Health has developed and provided guidance and worked in partnership with our healthcare providers, both in our hospitals, our primary care offices as well as our specialty care providers to ensure that processes are in place to protect patients during emergencies and normal medical care. All of the District of Columbia's hospitals have protocols in place to help keep residents safe when they need to seek care. They are ready and able to offer a full range of services and safely provide high-quality patient care. So it is critically important that before you postpone or cancel a health appointment or treatment, that you contact your physician and make in concert and jointly with your physician informed decisions about the need to receive that care in person or by using some of the other care delivery models that are available, such as telehealth. I wanted to provide some updates. Many of you know that we have lots of testing options in the district, some through our district-sponsored sites that are available at coronavirus.dc.gov, where we also make available other district-sponsored testing sites. But this week, we opened a second location for serology or antibody testing. The testing sites are located at the Navy Yard, Canal Park, 200 L Street Southeast, and the newer site located at Tacoma Community Center, 300 Van Buren Street Northwest. And both sites are open Monday through Friday from 9 a.m. to 3 p.m. If you are interested in getting a serology test, you must call for an appointment at 1-855-363-0333 to register in advance. The only requirement for the serology testing, in addition to having an appointment, is that you must be at least 6 years old and a district resident. Lastly, as you begin to make summer plans or continue to make your summer plans, as we're in the thick of it now, and participate in various activities, we want you to remember to protect yourself and protect others. Wear a mask or face covering, keep 6 feet of distance from others, and to choose your activities wisely. So before you go out to participate in those activities or any activities, go on outings with friends and family, we want you to always be mindful and ask yourself a question. Is it necessary, and am I putting myself at greater risk for exposure to COVID-19? So for more information about COVID-19 and the district response, we always want you to visit coronavirus.dc.gov, and I'll turn it back over to you, Tomas, for questions.
Thank you, Dr. Nesbitt. And want to remind everybody that if you have a question, you can press 0 now to be entered into our question queue. So again, if you have a question, please press 0 now to be entered into our question queue. We'll start out with our first question from Linda in Ward 3. Linda, your line is unmuted.
Hi, this is Linda, and I wanted to thank all of you for all your work in these calls and the really thoughtful and slow process that you've had in reopening. But I did want to ask, given how terribly it's going in the rest of the country, are you actually changing your criteria that you've had all along to, have more hurdles before we go to the next phase?
So thank you for the question, and if I'm appreciating the spirit of your question, if we have changed the criteria that we are using for our phased reopening, I'd ask you to visit the coronavirus.dc.gov website, where we have posted the criteria that we are currently using for our phased reopening and decisions that DC Health and data that DC Health monitors are for moving into phase 3. When we made the recommendation and the decision to move into phase 2, we made it very clear that the decision points for moving into each phase are very different. The public health scenario and conditions that need to be in place for DC Health to be comfortable with the recommendation to move into phase 3, which is the final set of activities as we have imagined them or thought about them prior, before there is the availability and broad take-up of a vaccine, is phase 3. So we would essentially need to be in a situation in the district where all of our cases are sporadic or occurring in clusters. And so the metrics that we have outlined to be looking at while we are in phase 2 are designed for us to be able to assess whether or not that is occurring in the district. There is a lot of popular discussion that occurs that would seem to imply or suggest that the only metric that the district has been using to move into different phases are these 14 days declines. That is not true. That is the more commonly discussed metric, but the health department uses a number of other criteria. And so we will need to see more of our cases be related to each other. That's something that we have always known was important. We know that we have believed that it will take far more than 2 weeks to be able to see that. So at this time, despite what's going on across the rest of the country, we have imagined that it will take some time for us to begin to see that type of trend where more of our cases are related to each other. Now, any prudent public health practitioner and public health professional who is advising during a pandemic will seek to learn from other jurisdictions, whether those jurisdictions be similar situated cities, states, or countries who are further along in their response. So the District of Columbia and the public health practitioners here are always looking at the best practices and things that can be learned from other jurisdictions, and we want to be wise public health practitioners that leave ourselves open, if necessary, to gaining insight to what can be learned from what is happening in those other jurisdictions.
Thank you, Dr. Nesbitt. We'll go to our next question. Before we do that, I want to remind everyone, if you do have a question, you can press 0 now to be entered into the question queue. We will next go to Sherry from Ward 7. Sherry, your line is unmuted.
Good evening. My question relates to the test results. Several weeks ago, it was reported that many people were delayed in getting their test results that should have come in maybe 2 or 3 days were taking at least 10 days, in a few cases even longer. Why was there a delay in the test results coming out? And for whatever that reason was, has it been resolved? I've recently taken an antibody test. I took it a week ago today. I was told it would take about 10 days, so I'm not concerned yet that I haven't gotten the results. But I just want to know if there was an issue in the delay, whether it's been cleared up at this point.
Yes, this is Chris Rodriguez. I can answer the question. Thank you very much for that question. And what we are seeing across our testing sites, not only for the district, but also in the commercial laboratories, is high volumes of testing. So we are very encouraged that our residents here in the District of Columbia want to get testing, and we're averaging about 1,600 samples per day running through the district-supported testing sites. Some of the things that we have seen in terms of, ma'am, you were mentioning the rejection of some results or the length of it has to do with a few things. The first is lab sample rejection. So, for example, if someone's date of birth is entered wrong or contact information is entered wrong, sometimes that can result in delays of people getting their testing. The temperature of samples, for example, as they move from the site where the testing takes place to the labs, sometimes they become too warm, and it kind of makes it difficult to run the tests. Those issues, to your question, have been resolved, and we continue to make sure that stays that way. And so there's also other things such as samples that might be what are called sort of unpaired. And what that means is, again, the contact information is not pairing with the information that's on the sample. So we are in the process of working to fix that as well, as are the commercial labs. So the good news is that we continue to have good turnaround times for the samples. But again, we are working on the issues that have, in some cases, made it difficult for people to get their results in a quick manner.
Thank you. Dr. Rodriguez, for that. And I want to remind everyone again, you can, to find all of our testing locations, you can easily go to needatest.getatest.com or coronavirus.dc.gov for all of our testing locations. The map and where they're at and what days they operate are all available there. So we'll go next to Joanne from Ward 6. Joanne, your line is unmuted.
Hello, all. My question is, will businesses be taking temperatures of customers and collecting, and asking health questions and collect contact information for contact tracing? I had this experience when to get my hair cut in Maryland, Montgomery Mall, and I thought it was very thorough and didn't know what our plans were in D.C.
So I would encourage you to visit. I would encourage you to visit coronavirus.dc.gov/phase2 and review many of the guidance documents that we have provided for businesses operating in the District of Columbia pursuant to our mayor's order for phase 2. So a number of businesses are now permitted to operate, including personal services, restaurants, and we even have guidance documents for offices. We have provided guidance to our local businesses related to temperature checks consistent with the CDC recommendations in terms of how to safely check a temperature. So it depends on the skill set of the individual who is checking the temperature as well as the type of thermometer to be used. In some situations, it may be safer for individuals to attest to not having a fever than to actually have someone physically there checking temperatures if that individual is unskilled and maybe inadvertently touching people, not washing their hands, etc. And you can visit our website or the CD's website to understand better what I'm communicating. We do have a sample questionnaire that we have provided to get people and businesses to understand when we recommend for screening employees and screening patrons before entry into a specific business regarding their symptoms. That could be done while the individual is still at home, depending on the patron and the type of service, or as they enter the premise. We have provided that sample questionnaire. As you all know, that there are a wide spectrum of symptoms that an individual may have that could be indicative of COVID-19. So the sample questionnaire is quite comprehensive that we have provided. Lastly, we have also recommended and required in some instances that a documentation of who is in the business be done and be kept on file for a minimum of 30 days. And that helps that if an employee or a patron of a particular business is diagnosed with COVID-19, it helps DC Health conduct its contact tracing. But all of that information is available to you if you visit coronavirus.dc.gov/phase2, and we encourage residents to review those materials in advance of patronizing any of our businesses that are open during phase 2, including our parks and open spaces.
Thank you, Dr. Nesbitt. We will go next to Nancy from Ward 6. Nancy, your line is unmuted.
Yes, good evening. This is Nancy Harvin. And I asked a question maybe last week or week before concerning D.C. government buildings as we look hopefully towards getting back to work in those buildings. And I was told that there are some protocols that are in place for cleaning these buildings and that administrators have those plans. But as I talk to my coworkers, D.C. government workers, none of us have been advised of what those protocols are. And I'm very concerned about that.
Yes, hello, thank you for the question. This is Chris Rodriguez, Director of Homeland Security and Emergency Management. So the D.C. government operations team working out of here, the Emergency Operations Center at the D.C. Department of Health, has been working with D.C. HR to create return to work guides for D.C. government. Those guides also include mandates really for return to work committees that are set up throughout the different agencies and departments in order to make sure that proper signage is put up in buildings, make sure that people social distance, and make sure that we're following all the public health guidelines for containing the spread of the virus. And so through the city administrator's office, there has been a concerted effort to make sure that we are doing everything we can to protect our employees and those essential workers who are still at work and those who might come back in the future. So those efforts have been ongoing for the last couple of months, again, with an attention to following the strict public health guidelines from the CDC and the DC Department of Health to make sure that our workforce is as safe as it can be in the midst of the pandemic.
Thank you, Dr. Rodriguez. We'll go next to Darnice Bush in Ward 8. Your line is unmuted.
Oh, hello, and thank you for this opportunity to speak. My name is Darnice Bush, and I live in Ward 8. Of late, I've been concerned about the texture and type of masks that are appropriate because they have so many different commercials. They have masks made out of cotton, 4-ply, 3-ply. Could you give me an update on what's appropriate and also the proper way to wear a mask? Thank you.
Thank you. I appreciate the question. And one of our first guidance documents back in, maybe March or April, it talks about guidance for the public on the use of masks or face coverings. And it actually, there's a section that says, so many masks, which one? To speak to your question. What we know as more evidence comes out about the usefulness of masks and face coverings is that a cloth face covering, including the types of bandanas and things that people wear, is useful in reducing the risk of transmission. It is not the same as what we recommend for healthcare professionals who are providing care in health settings that need to have on a surgical mask, or for individuals who are providing care, aerosolized procedures that need to wear an N95 respirator. But for those of us who are walking around in public, going into public spaces, are in our work environments, who are not providing healthcare services, a cloth face covering, even those that are made at home out of old clothing, are appropriate for use. The proper way to wear a mask is to ensure that it covers both the nose and the mouth, is tight and close fitting, but is not restrictive for breathing. That is the proper way to wear a mask. It is not proper to have the mask only covering the mouth, to be beneath the nose. That is not appropriate. It needs to be covering the nose and the mouth. And it needs to be fitting where there are not substantial gaps for air liquid leakage, but it should not restrict someone from being able to breathe. It is also important to make sure that you're not touching the front of the mask. It is also inappropriate to pull the mask down and let the mask rest under the chin. And you should not pull down the mask to speak. That defeats the purpose of wearing the mask.
Thank you, Dr. Nesbitt. We have time for just a few more questions, so if you haven't pressed the arrow yet, please do so now. We're going to go next to Miss Alkerton from Ward 7. Your line is unmuted.
Hi. My question is about the care homes. I don't remember if it was Dr. Nesbitt or the mayor who said several calls ago that 60%, I don't know, 62 or 66, but something in the 60% of the deaths in D.C. were in nursing homes. And I know that 62% nationwide were also in nursing homes. And I'm wondering, was there any guidance that was given to your office from Medicare, Medicaid, or from an organization, IHME, that is based at University of Washington, that you should that you should require that nursing homes allow residents back into the home even if they had a positive diagnosis?
I'm not quite sure I follow your question completely, but it is not inappropriate to allow COVID and if an individual, I will answer your question in a different way than maybe you phrased it, and I'm not quite sure what entity you're referring to in Washington State. It's not an organization that that has oversight of health departments or expertise in long-term care that I or my regulators tend to be familiar with, or that they reference when we're making decisions about long-term care facilities. When we responded aggressively to the increase in cases we were seeing in our long-term care facilities in April, and the actual percentage of our deaths that we saw that occurred in our nursing home and assisted living population is 34%. It's not 60-something%, so I want to make sure that you have that appropriate context. We recommended that they cohort individuals who were diagnosed as well as cohort the staff who were providing care to them. If a resident who lives in a skilled nursing facility required acute care in a hospital, it is appropriate for that individual to be able to return back to the skilled nursing facility and be cohorted with other COVID-positive patients. What is inappropriate is to deny individuals who have no other place to live readmission back to their home or the ability to return back to their home when their home is completely capable of providing care to them in a skilled nursing facility. It is demonstrated that you can reduce the transmission of COVID-19 in the congregate settings like long-term care facilities with the use of cohorting of infected individuals, exposed individuals into quarantine units, and the creation of non-quarantine, non-isolation units. What has to happen is that you also have to have cohorting of staff where staff don't work between units. You have to have what we call universal source control. So all staff wear personal protective equipment regardless of the diagnosis or status of the patient or resident that they're taking care of. And you have aggressive screening policies and procedures for all people entering that facility. And then there's a number of other procedures that have to be in place regarding who can come in the facility, strict visitation policies, et cetera. And we continue to have these policies in place now, which is how we have aggressively curbed the amount of infections in our skilled nursing facilities, where we have over 2,600 residents residing in the District of Columbia at present. And if you want, you can go and you can visit our coronavirus.dc.gov Phase 2 recommendations that outline some of the testing requirements that must be in place for residents and staff, some of the requirements we have for communal dining, the requirements we have for visitation, and a host of other things that need to be in place in our congregate setting, long-term care congregate settings in the District of Columbia.
Thank you, Dr. Nesbitt. It looks like we got time for just two more questions, so we'll go next to Kevin in Ward 6. Kevin, your line is unmuted.
Thank you so much, and thank you for all the work you do. It's a relatively simple question, but as a administrator of a sports league, who, typically getting ready for registration, we're looking around at other leagues to find out what they've done. And they've done things like, not cancel the youngest age group who, can't social distance. But does the team have any advice for sports leagues in terms of registration, given that, school decisions still need to be made and DPR is, has certain regulations? Any advice for sports leagues in the fall? Thank you.
Thank you. I'd encourage you to review our current guidance for Phase 2 related to parks and open spaces, where we provide guidance for what we are recommending related to sports based on the level of contact, and would advise you regarding the type of sport that you coach or you oversee based on that level of contact. And I also caution people against any thoughts or perceptions that children are not transmitters of COVID-19. There's still a lot that we are learning about children and their ability and risk to transmit the virus, and we continue to observe what happens as children are grouped and cohort together. So we do know that there are sleepaway camps that have been convened in other states that have had to close because of children, because of outbreaks occurring among children. So we just need to make sure that we keep those things in mind and not make assumptions that children do not transmit COVID-19, and be mindful to continue to follow the guidance around going slow with low contact, and then as we move into more phases of our Phase 3 opening, following the guidance in terms of permitting more contact at later dates.
Thank you, Dr. Nesbitt. And we'll go to Patrice Jones from Ward 4 for our last question. Patrice?
Hi, everyone. First, thank you for the opportunity to ask a question. As I mentioned to the gentleman before, I'm a teacher. I'm also a parent, and I have school-age children. So my question is around the type of testing that's available for school-age children. Do they have to take the nasal swab that's been shown on the television, or is there an alternative, maybe like a swab in the mouth or some other type of testing that's available? And as we think about schools reopening in the fall, what is the likelihood of some type of plexiglass barrier around desks for students and staff in the case that social distancing is not an option?
So I'll quickly take these last two, and there are two different types of tests that are now available, and the availability and access to the test depends on your healthcare provider. So we encourage you, when you contact your healthcare provider for your child to be tested, to ask about the type of test they have available. The nasal swab is the most common. It appears more uncomfortable than it actually is for people. There is a swab of the oral swab that is a swab of the inner cheek that can be done, but the access and availability of that is far more limited. It is more important to have a person, including a child, who has symptoms and who has an exposure be tested than it is to figure out how to get access to one type of the test or the other, given the not always the broad availability of the oral swab in certain communities and in certain physician practices. The second one is the district is still working to finalize its plans related to school reopenings, and when those plans are released, it will address all of the components, including classroom sizes, the options for in-person or learning or any other modalities, as well as how classrooms will be structured and designed.
Thank you, Dr. Nesbitt. And thank you, Dr. Nesbitt and Dr. Rodriguez for joining us for the call today. And thank you to everybody, all of our residents from across the district for joining us as well. We'll see you next week, same time, Wednesday at 5 o'clock for our next community leader call. And want to remind everyone again, for the most up-to-date information and resources related to the district's response and recovery efforts with COVID-19, you can visit coronavirus.dc.gov. Thank you all so much for being here with us this evening. Goodbye.